So let's start first with why you had an interest in this area and why you chose to undertake such a study.
Well, I run a call center, the Infant Risk Call Center in Texas, and we get calls from everywhere in the world, and we get numerous calls about marijuana. And many doctors call and say, should this woman breastfeed? Can she breastfeed if she's using marijuana? And so it's a very prevalent question. It's one that we've never had an answer to heretofore. And so I just thought it was very important that someone do something to try to figure out exactly how much marijuana enters breast milk compartment. The older studies, I don't think were quite accurate, and therefore I thought it needed to be done because the levels they reported are simply too high. And so we decided that it would be very important in this modern era with new types of marijuana to go in and very accurately determine the transfer of delta-9 THC into mother's breast milk. As far as breastfeeding, the data on breastfeeding was 35 years old. It doesn't seem to be quite accurate. It was done with older forms of marijuana. In today's world, we use much more concentrated cigarettes or more concentrated forms of cannabis, and so we decided that it would be pertinent to do a very good pharmacokinetic study on the transfer of delta-9 THC into human milk. And so to do that, we first had to learn how do people use marijuana. And so we found that it was the easiest thing for us to do, because we're in the state of Texas where it's illegal, would be to go to a state where it's not illegal to do. And so we did that, and we arranged to have mothers ingest a certain amount of marijuana, a very accurate amount of marijuana, and to provide us milk samples at various times, half hour, 1 hour, 2 hours, and 4 hours. And to provide us we're using a well-known method, and then we can use our laboratory facilities to determine the amount of delta-9 THC in breast milk. The outcome is good. The levels are not terribly high, but that'll all come out in the next month or two when the paper is published.
Okay, so stay tuned for the paper.
Stay tuned.
Do we know yet where it might be published?
Journal of Obstetrics and Gynecology, the Green Journal.
Okay, fantastic. And what would you say are some things for doctors to watch out as marijuana does become legal in Canada in the next few months? What advice would you give to clinicians?
Well, the advice to pregnant moms is that we have other drugs that we know are not teratogenic, can be used for nausea and vomiting pregnancy, and marijuana is not a good choice for that. And I don't think it should be used in pregnant mothers. Now, most mothers that use it won't agree with that, but that's fine. At this point, we're ignorant, totally ignorant in humans. We simply do not know whether or not it produces birth defects. We just don't know that yet. As far as breastfeeding, I think there's a different story that's going to come, and that's going to come with more and more studies like mine that come out that are probably going to detail that there may be a short interval of 1 to 2 hours where milk levels are a little bit higher, but mothers can avoid those peaks by simply deferring breastfeeding for about 2 or 3 hours, or 4 hours. And it might be that, that the exposure to the infant is going to be quite minimal. The good thing is that whereas marijuana in the plasma compartment of a mother may rise quite high, and the milk levels may be moderately low, quite low, the amount of marijuana in breast milk that's going to be absorbed orally in the infant will be minuscule. Even in adults, it's less than 5% is absorbed orally. And so small amounts in milk goes into the baby's stomach, little of that is absorbed, maybe 5%, maybe 1%. Therefore, the clinical dose in the baby, I think, is going to be exceedingly low. Okay. Again, this is just a preliminary first study. We have more planned where we can discriminate more carefully exactly. And it'd be lovely to be able to look at the infant plasma compartment. I don't think we will see anything there, but we'll have to wait and see.
Okay. Great. Well, thank you very much.
Okay.
I know that many people will appreciate this advice, especially with the changes that are coming up societally in the horizon. So thank you very much for your time today, and thank you for an outstanding presentation at the Medela Symposium.
You're welcome.